Hi, everyone. I'm Kristan Hawkins, and welcome to this new episode of the Explicitly Pro-Life podcast. We are in season 3 of having difficult, hard conversations. And today I brought on Missy Stone. Missy, you may remember her. She worked for Students for Life of America for a number of years. She left us to move to Louisville with her husband and now has a little baby girl and is the director of operations of a new pro-life organization, Reprotection. And I said it right this time.
You nailed it. It was great. That was great.
Yes. But I wanted Missy to come on and share with you guys a little bit about the organization, what they're doing, because it's so behind the scenes, but so deeply important. It's filling this very much needed gap, this hole in the pro-life movement right now. And I actually think what you're doing, Missy, will actually help us in our conversations when we're talking about how the abortion industry harms women, because you have firsthand knowledge that, a lot of these things are happening behind the scenes in these clinics and facilities that nobody else has.
Right. Absolutely. I think there's definitely a narrative that Planned Parenthood especially likes to say that they are all about women's health. Abortion is women's health care. But when you pull back the curtain and you look at how these abortion businesses are treating women, it is the opposite of healthcare. And so that's where we come in. Reprotection started out of a need for abortion facilities to actually follow the laws that were already in place. So the pro-life movement has done a great job at passing pro-life legislation. It's been a huge strategy the past few years, where Roe versus Wade and Doe versus Bolton open the floodgates, open a wide abortion on demand for whatever reason at any point. There were no regulations. And so states started coming in and saying, this is not safe. We need to have common sense regulations. And it's been awesome. It's been a great strategy. However, what we found was in states like Indiana, in states like Kentucky, where we have very robust legislation to protect women, specifically from dangerous abortion providers, the laws were not being enforced on a government agency level. So the people, even if at the top we have pro-life governors, we have pro-life legislators passing these laws, it really came down to who is the person in the agency that is required to make sure they are following the law. And if they didn't agree with it, they just didn't do it. And so we had all of these amazing laws on the books and the abortion businesses practically acting like they didn't exist. So Reprotection has kind of come in to bolster those pro-life laws and say, if a state has said this is the law, then we have to make sure the agencies are holding the abortion businesses accountable. So that's kind of where we fill in the gap.
And just to be honest with you, you all shouldn't need to be out there because the state should be doing its job.
Yes. So we fill the gap where the agency should be inspecting, regulating, holding them accountable, but they just aren't paying attention or they turn a blind eye. And like you said, this isn't something that we should have to do, but unfortunately we do, because there is this mindset that it's abortion no matter what, and they will protect people that support abortion, will protect it at all costs. And if that means letting a really dangerous abortion provider keep practicing, then they're going to do that.
Yeah. And I think that's one of the things that we talk about all the time is, just because you might get something done by the president, for example. The
Right.
president could sign a great executive order, not obviously for the next 4 years, but it doesn't mean his administration will actually follow through with that. And it's the
Exactly.
personnel's policy, and it's the exact same thing happening at the state levels. So can you
Yep.
give us some examples of what, you all have been around for what, 2 years of
Yeah.
reprotection?
Mhm.
Give me some examples of some of the terrible things you all have discovered that are going on in these abortion facilities that no one is monitoring. And how did you guys, tell me the bad things, but then tell me how you found out about them and then what you
What
did.
do we do? Right. Yeah. So I'll give you a couple of examples that aren't abortion specific, just to show how far these businesses will go. We're not talking about just trap laws. We're talking about basic medical standards. So every state has mandatory reporting. If you treat a patient that is under 16, 14, 13, 12, whatever the state says, that there has been obvious abuse in those cases. So if an abortionist is treating a 12-year-old pregnant girl, the state says that is abuse. She has been abused because she cannot consent at that age. And so we had a situation in Indiana where the abortionist was not reporting to Child Protective Services that he was seeing patients as young as 14, 13, 12 years old and doing abortions on them, even though that is, like I said, basic medical. Any physician in any kind of practice that sees a patient that young that has evidence of an STD or pregnancy, that there has been sexual contact, has to be reported.
And physicians, like teachers and
Yes.
other folks, the state can decide who's a mandatory
Yes.
reporter for statutory rape.
Yes, exactly. And this physician said, it's not my business. That's the family's business, and sent the girls right back into abusive situations. And so the state has had a reporting requirement that said they have to report all of the abortions that they do, how old they were. And there was even a box on the form that said, did you report this to Child Protective Services? And he didn't check the box. But guess what? Nobody was paying attention. He turned in his papers. The government agency just stamped whatever, it went on. So they had passed this law that said, hey, an abortionist, you're a mandatory reporter. You need to show us that you are reporting these.
Mm-hmm.
But there was no follow through. No one was looking. And so we looked at, you can get open records. So legally, you can ask your health department, your medical board, any kind of government agency for reporting records. And so we got the records and we said, let's look at every abortion that this physician has done. And we noticed he hasn't checked these boxes. And so we had to bring it up to the medical board and say, he did not report abortions on 12-year-olds, 13-year-olds, and 14-year-olds on multiple occasions. And ultimately that got him taken in front of the medical board and his license was suspended. So, we had to do the work because the government agency just wasn't paying attention. And, he thankfully, his business shut down, and he died a couple years ago. But that is a prime example of, this is just basic medical care, even outside of the abortion facility. And he wasn't doing it.
Wow. And so by just doing some check up on the paperwork, on the laws that have been passed to make sure the state's doing their job, you found out the state wasn't doing their job.
Right.
You were able to report this. He had his license suspended. So babies' lives were saved.
Yes.
Because he wasn't there to abort them.
Yes, exactly. He had 3 facilities that he ran. And instead of going through the work that the medical board put on him to say, this is what you have to do to get your license back, he just said, I'm done. And his 3 facilities shut down. So that is a really good example of a great law being passed, a completely apathetic government agency, and how we can step in and say, this is dangerous. This is dangerous for the girls that were taken to these facilities by their abusers and then sent right back into abusive situations. I mean, that is not healthcare.
No, for sure. We often hear that, these trap laws, targeted, what they call them, targeted abortion restriction provisions.
Yeah, right.
And they call them TRAP or targeted restrictive abortion. I don't know. But, and that's how they use anytime pro-lifers try to pass pro-life legislation in a state. They'll say, oh, this is a trap law. This actually doesn't really need to be a law. And the Supreme Court actually even said, in the latest ruling with the Mississippi, case that well, access trumps safety, that the women have a right to abortion.
It blows my mind. It really does. That because what I hear when I hear the court say that is that women's lives are not worth anything to you. That if you are willing to subject women to such degrading situations, that even if it is access, but you're putting them into dangerous situations that could ultimately cost them their lives. It doesn't make sense to me. And that court case has always really bothered me for that reason, because it speaks so much to how little they value women.
And how little the abortion industry values women, because they're the ones arguing that these laws are unnecessary.
Yeah.
And that it's just so frustrating.
It is frustrating.
So, all right. So my husband's mad at me and is running the vacuum cleaner right now, even though he knows we're recording this podcast. So, I'm going to have to go on mute. Okay. But this is just real life for you all when your husband's mad and cleaning the house. Yeah. I wanted you to kind of walk through for our listeners what it is they can do and what they can be looking for in their community.
Right. So as we have developed, because this is a new organization, we've only been around 2 years. We only incorporated last year. And one of the biggest things we found was, as far as pro-life leaders go, is a lot of them witness things outside of the abortion facility, like specifically sidewalk counselors or the pregnancy center directors are talking to women who were abortion minded and went for their first appointment, or women who had the abortion and then come in for healing. And they hear these stories and they go, that doesn't sound right, but they have no idea what to do with that information. And there's never really been a safe, strategic place to put that, where they just say like when sidewalk counselor called me, this is a situation we have right now where a girl physically pulled herself off of the bed in the abortion facility and ran out because she was having trouble breathing. And the abortionist was saying, it's just be quiet, like whatever. He wouldn't address it. And so she physically pulled her and ran out of the facility screaming, call 911, call 911. So they got the whole situation handled. But what do you do with that? She had no idea, she had no idea where to go, who to tell. And so we've created this kind of avenue for people who witness things, who find things out, to come to us and say, this is what I saw, this is where I am, this is what I saw, or this is what I heard. And then we come alongside them and help them go to the appropriate authorities. So we take on the burden of writing the complaints, because it's so complicated. It's complicated. It's you have to use specific language. You have to go to specific boards for different issues. So we take on that burden. But the biggest thing that people can do is, when you hear something that just doesn't quite sit right, if you're outside of the facility, if you're talking to women who've been inside and you go, I don't think that that's legal, or that doesn't sound like quality medical care, we've created this place for you to come and say, can you look into this for me? And so we take on that burden. We look at the laws in the state, in that area, and we say, yes, that was against the law. We write up the complaints and we get them submitted to the right people.
Do you guys have an online portal for this, or is this just they text someone?
They just email. Right now, like I said, we're so new. It's just info@reprotection.org. It comes straight to me, and then our team looks at the situation. We have kind of an intake call, and we talk to the person, like, what did you see? Do you get all the information that we can? And then we kind of launch an investigation. But the biggest thing is knowing the laws in your state, knowing what your pro-life legislators have worked hard to pass, and then putting yourself in a position where legally you can see or hear what's happening inside the business. So talking to women compassionately and advocating for them and saying, hey, that doesn't sound like that was a great experience. Do you want to tell me about it? And giving them that option to hold the abortionist accountable.
I guess this is a big question that I get asked. Where does someone go to find out what the actual laws are in their state? Like, where do you get that? I mean, a lot of people don't even know how many abortions are being committed in their community. Where do you even go to get that information?
So this is where it gets complicated. And like I said, this is where we take on a lot of the burden on us, because we know how to navigate this, because every state is so different, and every state has their own database for how to look up codes. And so honestly, the easiest thing that I found is using NARAL. NARAL has this whole website that goes state by state, and obviously it's a criticism saying you can't access abortion in this state because of these laws. And it's been really helpful for me, because they lay out all of the laws, all of the quote unquote restrictions in the state, so you can kind of see what your state has done. But every state should have some kind of legislative database where you can look it up and see kind of what's going on in your state.
Where can folks go just to figure out who's doing abortions and how many abortions are being committed? If they've never, joined a 40 Days for Life, or they haven't gotten involved in Silent Advocates, where can you go to get that information?
So this is interesting. A lot of people don't realize this, but most states, I think maybe Hawaii, California, New York might be the only ones who don't. Most states have abortion reporting laws, and they put out an annual report that says this is how many abortions were done, and then some demographic information. And it's all housed in usually something called vital statistics, it's the same place you would go to get birth certificates, death certificates, and things like that. They actually have to report abortions to this office, and those are all open records. And so every year, this department has to produce an annual report saying, in your state, this is how many abortions had taken place. Now, again, it varies state to state on what information is available, but that is the most accurate data that you can receive, because that's what the abortion industry has reported that they've done. So that's the biggest resource, I would say. As far as who is doing them, that's where relationships really come in, because like I said, the regulation on these abortion facilities it varies state to state. So sometimes you can go to your health department and say who has an abortion license. So in Kentucky, you have to be licensed as an abortion facility to do abortion. So I can go to the health department and say, who has an abortion license? And they'll give it to me. But it kind of depends on what state that you're in. But most states have some kind of licensing where they say, in order to do abortions, you have to have this specific license, and you can ask for that information too.
How can if someone's listening to this and it's like, oh my gosh, this is my niche. This is like, I love research. I love being behind the scenes, like not my thing.
This is my thing.
It's totally your thing.
It's totally my thing.
It's totally where God wants you. But how can they get involved? Like,
Yeah.
are you looking for help or volunteers?
Oh,
Or-
absolutely. Yeah, absolutely. What's funny is, like you said at the beginning, I worked at Students for Life for a number of years, and I begrudgingly was the activist. I would go out there and I would do the activist thing and I would hold the sign, but deep down I was like, this is not my calling. This is just not. I felt a little bit like a fish out of water. And then when this opportunity presented itself, I was like, wow, there is a place for introverted pro-lifers where we can go and we could do something that is so, helpful and effective, that doesn't require me to be in a large group of people. So for all of you introverted pro-lifers that are looking for a way to use your administrative skills, your research skills, things like that, we have so much research to do. I mean, like I said, we just started and we have a number of investigations going, but, there are hundreds of abortion facilities that we haven't even begun to tap into. And so having somebody volunteer hours for looking up code or looking up, connecting with people in areas that are outside the abortion facilities, or, we read through so many documents. That's where most of my time goes, is just reading through legal documents, looking for evidence of wrongdoing, and so anybody that likes to do that kind of stuff, we are always looking for extra eyes and help, as far as digging up information.
Yeah, and I think it's important that you just know about what Reprotection's doing. So when you're volunteering with Sidewalk Advocates, or if you're volunteering for 8 Days for Life, if you see something, or if someone says to you, I saw something last week that seemed a little weird, there's a place where I can go. I can email or call Missy and tell her, and she can help with the investigation part, even if I may not exactly know what it is I should be looking for. Because I think that's so important. What are some other, since you've started at Reprotection and what you've been doing as director of operations, what are some other, cases that you can publicly talk about now have come out? Because I follow your all Instagram, but it's pretty new.
Yeah.
Like, I'm like,
just when I have time, I can throw something.
Where are the stories? That's always something I always said, Students for Life. Like, if we don't talk about it, it didn't happen. So
it's a little complicated, because we have to, these are investigations, and a lot of these are ongoing, and we're working with women who are still sensitive and healing. And so we have to kind of be careful with what we share, because their well-being is always first. We never want to put women in a situation where they feel like we're just using them to push our agenda of closing down an abortion facility. And so we have to kind of walk this line of letting people know what's going on without doing anything that's going to compromise the investigation. So that's why you kind of don't see as much on that end. I can tell you about a couple things. We have a number of investigations going on in Georgia and Florida, are our two most active states right now. We have a physician in Georgia who he, like a lot of abortionists, is a piece of work. And he was using doctor's notes. So women would come in, have their abortion, and then he would send them home with, some kind of note for their work or for their school saying she needs 2 days of rest. But the name on the note was a physician who had been dead for 6 years. So it sounds bizarre, but you have to kind of think past, like, what are the implications of this? It means that very few people probably know that she had an abortion, and she's gone home with this paperwork that has the wrong physician's name on it. If there was some kind of complication, who are they going to call? How do they know what happened if there's no information about the actual facility and the physician who treated her? And so, it sounds like on the front end, it might not be a big deal, but it is a big deal, because this physician needs to be able to be reached, or they need to know what's going on if there's some kind of complication in her recovery. And, another story came out where he was, in an attempt to get more women through the doors and out the doors, he was putting 10 women in a room and dispersing the abortion pill all at one time. You know, so that's where it's like, oh, this is just money business. He's just trying to get people in and out as fast as they can. And, you know, there's a girl that's crying because she doesn't know if she wants to go through with this, but there's peer pressure because there's 10 women in this room. And so she just takes the pill anyway, you know?
Oh my gosh.
So it's, you know, they're heartbreaking stories, like the one that I said, where this girl got herself off of this table and ran out of the facility saying, I can't breathe, call 911. She was either having some kind of reaction or even a panic attack. But anytime a patient is saying, I can't breathe, the physician has to stop and address her breathing issue. And he just didn't do it. And a couple other things that we hear all the time are, I tried to change my mind. I wanted it to stop, you know, and they said it's too late, or I can't stop it before the procedure started. They're saying, I don't want to do this anymore. And they're like, it's too late. It's too late. You can't change your mind now. That's blatantly false. A woman can rescind her consent at any point. And the abortion industry says, no, you're here. We've already started. You can't stop. So that's something we hear during COVID. We had so many stories of abortion businesses completely disregarding all CDC safety guidelines, you know, not taking temperatures, piling people into waiting rooms that were supposed to be closed. Here in Louisville, they had a patient that had symptoms, and she didn't leave the facility until she'd been in there for 2 or 3 hours before they were like, oh, you're coughing and like have a fever, you probably should leave. You know, just there's an entitlement that they're just like, we don't have to obey any laws because the abortion industry is going to come to our rescue. So and COVID regulations
allowed it. The governors labeled them essential businesses, showing that they have preferential treatment. Like, I couldn't get into the dentist for months. Because of COVID, but and I had like an actual tooth problem, but that wasn't essential, but killing a child was.
Yeah. I was pregnant throughout COVID, and to go see my OB, I had to wait in the car. I had to call and say, I'm here. They had to call me up. There was no waiting rooms were completely closed. Go directly into an exam room, get my temperature taken. I can't have any symptoms. My husband could not come with me for any of my appointments, couldn't come with me to any of my ultrasounds. But if I wanted an abortion, I could have walked right in, you know, and those are such comparable situations here. But they were just piling women into, and women were coming from out of state when they weren't supposed to, and essentially exposing already high risk patients to COVID. But, you know, that's just, again, the government agencies refuse to hold them accountable for that.
That's unbelievable.
It's unbelievable.
Where do you, like, how does this information get out? Like, how do we get this information out? That's my question.
We do podcasts with our friends.
But we need more. Like,
I know.
We need more of this information out there. Because, I mean, this is so critical to everything that we've been saying about how the abortion industry is an industry. They are a business. They are not about women's rights or protecting women. They are there to make money. And the stories you just went through are clearly demonstrating that. That it's about the dollar and how many abortions they can have in one day, not protecting their patients.
Right. Yeah. I mean, it really comes down to, it costs money to be in compliance. And so it's so much cheaper for them to use unlicensed staff to do things that they're not licensed to do, like ultrasounds. We get that story all the time. Ultrasound technicians without proper training, but it's cheaper. You can pay them less. Or having nurse practitioners or physician's assistants doing abortions or giving the abortion pills when it's supposed to be the actual physician, licensed physician, because it's cheaper, you know. So it costs money to be in compliance. And so that, honestly, I think is one of the number one reasons why these abortion facilities cut these corners is because they're just trying to save money. If they could have a glorified office manager meeting with patients ahead of time to go over medical risks, like that's cheaper than having a licensed professional do it. And so when we are holding them accountable, not only are we protecting women and children, but we're also, it's making it harder for them to make money, which we know is, as a lot of them, that's their priority.
Yeah, I mean, I think during the Kermit Gosnell trial, when all of that came out, I think it was in 2012, and about his, horrific abortion facility there in Philadelphia, he was a legal abortionist,
right,
committing some illegal late-term abortions, had the separate waiting rooms for white and black women, had, cat urine and feces all over the place. He was storing the bodies of the children in plastic milk jugs in the staff refrigerator. It was kind of like the media totally ignored that case. And it was like, oh, well, this was just a special story of a crazy person. Like, no. Kermit Gosnell was not an outlier.
No, he's not.
He's
absolutely
not an outlier. Not. And I think Father Frank Pavone, Priest for Life, has a very famous saying, you can't practice
vice virtuously.
Virtuously. And it makes sense. I mean, these are people who, for a living, tear apart human beings.
Yeah. It does something to your psyche. It
does something. And I'm not saying that they start out like a complete psychopath in the abortion industry. I think a lot of folks get into the abortion industry feeling and kind of getting trapped into the mantra of, well, we're providing women's healthcare and women's rights and women's empowerment. But then when you face the reality of what it is you actually have to do that in an abortion facility, tear apart these children, then reconstruct them in the POC lab, the product conception lab, to make sure nothing is left inside of her that can cause sepsis infection.
Which not all the facilities do, and it results in incomplete abortions. This is something that we see regularly, is physicians not making sure that the abortion was complete, therefore leading to infections, hospitalization, emergency hysterectomies, yada, yada.
This is unbelievable. I'm thinking about my next season of the podcast, and we were talking about doing like a true crime series.
Right. Yeah.
I think you should be like a central part of that, because I think you're going to have a lot of these stories about what's really going on in these abortion facilities. And I hope, for the love of all that's holy, I hope you're recording all this so you guys can put it into a book, or at some point when it's enough time has passed that we can go public with this information.
Yeah. Here's the thing that we work so hard to do. And because I can already hear the critics saying, this is just sensationalism. You're just, whatever. Everything that I say, everything that we use, we will not use it unless we have absolute proof, unless we have documented testimonies, affidavits. I mean, we're not talking about just hearsay or speculation. We will only pursue situations where we have documented testimony and absolute proof that this is what's going on and this is who it is. And this is where, people can try to write us off as radicals or whatever. But like I said, we go above and beyond to make sure to be above reproach, that we are gathering all of our data legally and we're using things that would hold up in court. Like that is our standard. We have a legal team that helps us, that is looking at every situation with us. And we think like, okay, if we had to go to court, like, would this stand? And so we're not just throwing around stories or, some lady told her friend that told her cousin, these are stories that we have firsthand account or court documents that prove what's going on. And I think that's really, really important, that we can't be just written off as somebody who is, making up stories for their own agenda. You know what I mean?
And the truth shall set us free.
Yeah.
And hopefully everyone will listen, and we have a loud enough megaphone to tell it.
Yeah.
Which is why you need the extroverts and the introverts.
I know. We work so well together. Yes, we work so well together. We need each other.
Yes. Well, thanks so much for coming on today, Missy, and explaining what Reprotection does, and the critical kind of gap you're filling in the pro-life movement. I hope this has kind of gotten some interest sparked in some of our listeners or viewers who want to help you all, or at least when you're out there praying or being a sidewalk advocate and doing the advocacy out in front of the abortion facility, that you start kind of paying a little bit more attention as to the state of women who are going in, who are leaving, and start kind of asking those questions and maybe doing some of the research on your own to know what the laws are in your state before you get out in front of that abortion facility. So thanks so much for coming on today. I really appreciate it. How can everyone get this information? Yeah,
I think it's really poignant, especially right now, because most states are in session and a lot of states are in legislative session, and they're passing laws. And I think it's really, really, really important to note that just passing pro-life laws, we've now shown is not enough. And that's not a knock on the legislators. That's not a knock on the pro-lifers, the people who are lobbying for these laws. They're great. Keep doing that. But we have to take this extra step. Unfortunately, we have to make sure these laws are being enforced, or they might as well not exist. And right now, you can find us www.reprotection.org. We're on Facebook and Instagram, Reprotection. And if you hear anything, info@reprotection.org, that comes straight to me. And I read every email that comes in, and I will look into it and see, what needs to be done or what we can do in your area. So feel free to reach out. We're always looking for help. And if it's not something that you have time to do, we're always looking for support. So being a new organization that launched the year we had a global pandemic proved to be a little difficult. So, but we stepped out in faith, and God has honored that. And so, but we're always looking for partners. So yeah,
that's awesome.
That's us.
Thanks, Missy, for coming on today and sharing with us. And hopefully this conversation has been helpful for you all when we were talking about the predatory abortion business. And now it's not just one talking point. Now you have these stories. And now there's an organization out there who's actually going in and doing the hard work and the research that we need in the pro-life movement to make sure these pro-life laws that we fight so hard to get passed actually come to fruition and are being enforced in our state. So thanks for listening today. I hope this was helpful for you. Don't forget to hit subscribe and share this podcast with every pro-lifer you know, especially pro-lifers who are going out and praying or participating in sidewalk advocacy. Bye.